But first, there's this. It is day 24 of the government shutdown. Americans worried about their health care benefits as lawmakers are at a standstill in negotiations. The Senate failed to pass the clean CR for the 12th time this week. Democrats are holding out over Obamacare subsidies. President Trump giving lawmakers a stark warning over those critical services on Tuesday. Watch.
I saw it the other day. They were talking about, I call it the great big beautiful bill. And I saw they were interviewing a senator, and they said, well, what's wrong with their bill? He didn't know what to say, because there's nothing he could say. It covers everything. He said, death, death. It brings death. But it's just the opposite. It brings life. It brings Medicaid, Medicare, Social Security. It secures all those things. Theirs is death, because they're going to lose Medicaid, they're going to lose Social Security, they're going to lose Medicare. All of those things are going to be gone because the whole country would be bankrupt.
Medicare and Medicaid Services Administrator Dr. Mehmet Oz says that President Trump may have a plan to replace the Affordable Care Act altogether. Joining me now is the man himself, Medicare and Medicaid Services Administrator Dr. Mehmet Oz. Dr. Oz, it's great to see you. Thank you so much for being here.
Good to be with you, Maria.
So how would you assess the impact right now on seniors in this stalemate? Give us your sense of the impact of this government shutdown, first off.
Well, we're protecting seniors. We have mechanisms to ensure that programs that are vital to the care of seniors, but all Americans, remain functional. And in the case of Medicare, it's funded through mechanisms that don't require the year-to-year congressional action. So we're in open enrollment right now, by the way. So if you're over the age of 65 or on Medicare for other reasons, this is a month and a half time. You've got to go in there and take a fresh look at your benefits. So that's all functioning correctly. The call center is open. So we've been able to direct funds in a way that makes the system accurate. But the bigger reality is if half your people aren't at work, you can't do the broader planning required to run a healthcare system. We dole out about $1.7 trillion a year from Medicare and Medicaid. We need people actually working at all levels, from actuaries to insurance experts to folks who understand budgets to people who work on deliberating whether you deserve a service or not, just to do the quality control to run a system this large and to hold it hostage over desires that are unclear is concerning to me. I don't say unclear only because if you actually look at what the Democrats are claiming they want, like a repeal of the one big beautiful bill, do they really want to do that? Do they really want to repeal a law that says you cannot use federal tax dollars to pay for illegal immigrants to get health care in the states that want to do that? We actually went back because we've been, there have been accusations by the Democrats that that's not really a thing, that money from the federal government's not going to illegal immigrants. Maria, just in the last few months, in the few states that we've examined, less than half a dozen, we've identified more than $1 billion with a B, more than $1 billion of money, federal tax dollars that have gone to illegal immigrants. We're actually clawing that money back from those states now. But the fact that that could still happen is very frustrating to all of us. And why would you want to repeal that after all the work that was put into ensuring that these programs that work so well for vulnerable populations would remain intact financially?
Yeah, I mean, look, we're talking about all of this and the pressure on these services because there are expectations that these services can go insolvent in the next 10 to 15 years, certainly if you listen to the Committee for a Responsible Budget. So given your experience as both a physician as well as now a policymaker, Dr. Oz, what do you see as the biggest challenge here in terms of Medicare, Medicaid, and how do we fix it?
Well, the fixes to me are about empowering individuals, patients, the viewers right now, to become world experts on their bodies and take proactive steps. What drives 70% of all healthcare expenditures are chronic illnesses, which we do have control over. Obesity, by the way, is the number one reason that our healthcare expenses are increasing so much faster than other countries. Our obesity rate in America is almost twice as much of that of Europe. We're probably 10 times more of that of Japan. So obviously, an obese population develops hypertension, diabetes, a whole slew of downstream illnesses like heart attacks and dementia and kidney failure that are expensive to manage. So we are digitizing the healthcare system. The tech transformation of healthcare, which every major tech company is engaged in, is opening up wonderful opportunities. But this takes people and planning. And if you're bickering over the reality that money is being siphoned off for purposes that the rest of the country doesn't want it to go to, like illegal immigrants, or for other purposes, including fraud, waste, and abuse support, that's not done because you wanted to go there, but because you're sloppy in how you dole out the money, that's a problem. That's why we need a federal budget that makes sense in health care, and we have that under this president. He's been straight up on the fact that he wants fraud, waste, and abuse out of the system. He wants it to run more efficiently, and he wants to make sure we give the best care possible to Americans at every level. And Maria, you were at the Oval Office with us on Thursday last week when we announced another one of our most favored nation drug pricing arrangements. And this is a very good example. The president said, I don't want you hurting pharma. I want them to stay cutting edge, making sure they have the best solutions available to save American lives. But I don't want them taking advantage of the American people by charging 3 times more for the exact same pills made in the same factories to the American public than they charge in Europe, as an example. And so we were threading that needle, right, Maria? You saw that happen. We were able to take, in that case, listen, we started with the leading U.S. Pharmaceutical company, Pfizer. We went to the leading European company, AstraZeneca. Last week, when you were with us, we announced that we can drop the prices for folks who are struggling with fertility massively. From the drug that we gave as an example, it was $242. It'll be $10, which is even below most favored nation pricing, which is what the president insisted on. We can do both at once. We can walk and chew gum.
Yeah, I think it's a great point that you make. And the president has talked a lot about his plans to lower drug prices. He's been very, very serious about this. And the administration preparing reports that they're preparing a new probe into drug pricing practices, which, according to the Financial Times, would, quote, lay the ground for a fresh barrage of tariffs. Now, the president, of course, as you just mentioned, announced Trump RX, this new website selling medications directly to consumers at discounted prices. This was so great, and he's getting, broad applause on this. The president made massive deals already. He did a deal with Pfizer and AstraZeneca. I spoke with the CEO of AstraZeneca here last week. Here's what he said. Watch.
With the new technologies that exist today in manufacturing, but also artificial intelligence, this plant, with all those technologies, the cost of manufacturing pharmaceuticals can be managed better. This plant in Virginia is not only a simple facility manufacturing products, it's also going to include the most advanced analytics technologies, artificial intelligence tools. So at the end of the day, we are able to manufacture at a very competitive cost if we have new plants that are equipped with the most advanced technologies to manufacture. And of course, that creates very important jobs, high technology jobs, science jobs that are well paid and create themselves additional jobs in the community, in retail, in supply chains, and fuel the economy, of course.
So, Dr. Oz, what about that? Are we going to see more deals with specific drug companies? How do you continue this effort?
We want to roll one out a week or two if we can. We're very focused on what Pascal, the CEO of AstraZeneca, told you, which is we have the ability to bring all these major pharmaceutical endeavors onto our shores. U.S. employee individuals are going to be able to pay taxes, build families, but also we're going to have access to the security of knowing that the top medications on the planet are available here on our shores. I went and visited the facility he spoke about. It's a $4 billion endeavor in Virginia. Governor Youngkin was with me. I mean, this is a huge opportunity to build corridors of excellence. We can do it for generic drugs as well. And by onshoring these medications, we preserve our safety in case there's a global conflict, because many of these medications now are coming from China and India. So I'm optimistic about this entire process. I celebrate, the fact that the president has a vision that he will not be distracted from in any way. He believes in the MFN process, and we're going to deliver to him on that.
I think that is just terrific. You're actually making a serious difference here, Dr. Oz. Look, let me get your take on fraud, because you are also working hard to root out fraud in Medicare and Medicaid. How significant is it there? What are people doing, and what do we need to know about it?
We have estimates that we could have up to $100 billion of fraud, waste, and abuse. This comes in many different forms. I mentioned the illegal immigrant funding as an example. That's several $billions. But we've got folks who are registered in Medicaid in multiple states. That probably generates about $4 billion of waste. We have folks who are registered on Medicaid and the ACA in the same state. And that's probably about $10 billion of services that we pay for as at the federal government level, but we don't get anything back for it. Because if you're registered in both Medicaid and the Obamacare system in your own state, well, you don't need two insurance systems. Maria, half the people on the ACA, half the people in Obamacare filed no claims last year. I mean, how often do you have insurance and not use it for even a prescription? You know, it's unlikely. So we believe that up to 6 million of the people on the ACA don't even know they have the program or didn't want the program because they had coverage from somewhere else. We're seeing this over and over again. When 15 million people came off Medicaid last year, the 90% of them did not raise an issue because they had other coverage. So the U.S. government is paying for services we shouldn't pay for. But the most important thing we've got to do is get the stakeholders engaged. That means incentivizing providers to play a more proactive role in being efficient in how they deliver services, getting real value for what they're offering. But again, the number one by far is you, the viewer. We've got to empower the beneficiaries. Folks who are getting their insurance should be given wisdom based on their medical records, which they own. Your medical records, you paid for them. Use those medical records with partners who can help you manage whatever illness you're facing so we can get you back on your feet again and get you fully functional.
Well,
and Maria, let me give you one big idea.
Ahead.
What the healthcare system should do is not just pay the bills. We should make you so healthy that you flourish in life and you want to engage the workplace. Getting America back to work full speed, getting you to work longer if you desire, that builds trillions of dollars of value to the GDP. And that's the goal of the health system.
And that's what you've been a champion of for years. I mean, you've always told us, get ahead of illness. You've been a champion of preventive medicine. So before you go, I mean, are there specific ways that Medicare and Medicaid can better incentivize people to get healthier, get healthy behavior, get ahead of this, like you've always said?
Well, we're building in this tech transformation model mechanisms where we'll incentivize you by giving you access to tools, apps, benefits as well that you couldn't normally have gotten. Medicare Advantage has been doing that in its own way. Regular Medicare can do that. Medicaid has the opportunity to do that. But nudging you and making it easier for you to do the right thing allows you to be healthier. The MAHA movement, Secretary Kennedy's wonderful in speaking about this, is primarily about getting you to be curious about what you could do to be healthier. And the MAHA movement messages very clearly that you own your health, you have the opportunity to go places you never thought possible by making it easier to be healthy.
All right, we will leave it there. All great points from you, Dr. Oz. Great to see you, sir. Thank you.
God bless you.
All right, Dr. Mehmet Oz joining us. We'll be right back. Stay with us.